Can you please introduce yourself?
Hi, I am Dr. Pamela Jeyaraj and I am a radiation oncologist and I work in the Department of Radiation Oncology. And I have also done a fellowship in palliative medicine, so I look after patients who are terminally ill and who need symptom control and comfort care. And I'm also a part of the medical education unit in CMC.
Where and when did you complete your undergraduate and postgraduate?
Okay, that takes me back so many years ago. I did my undergraduation from Tirunelveli Medical College, which is a government setup down south, and I did my post-graduation from CMC in MD Radiation Oncology.
What made you pick radiotherapy as your specialty?
Okay, to be very honest, my favorite topic was forensic medicine, in which I got distinction. Next up to that, after that was ophthalmology. So these were my favorite subjects. And what made me take radiation oncology? Okay, so I came here during the days of terrorism. So when I came in 1991 in January, and I got a placement in radiation oncology department, and I stayed here. Staying here for 6 months, it sort of triggered my interest in oncology, and I felt the unmet need for cancer treatment and also how it draws you closer to the patients.
What is your favorite TV show?
Oh, my favorite TV show, I'm quite old, so my favorite TV show is Mind Your Language. I don't know whether you guys know about it. It's very, very nice and full of jokes.
Can you walk us through an average day in the hospital?
Yes. Why don't you come to my office? Okay, I start my day at 8 o'clock, and every day without fail I have an academic session from 8 to 9. Following that I go for ward rounds, and then I have my general OPDs on Tuesday, Thursday and Saturday, and private patients I see any day, and we do a lot of research work also here with my residents. So that makes my work very interesting.
What is the most rewarding and toughest part about your job?
Okay, the most rewarding part is like when patients are cured, when we are able to get on top of the cancer, and then they come for, some survivors come for more than 15 years, 20 years, and then they come and they give you a hug and they're so grateful to you, and then they say thank you. That is the most rewarding part. And the toughest part is when we go through their emotions, like when we have to break the bad news of the diagnosis of cancer or unresponsiveness to treatment, and or there is progression of disease. Then we also go through the same emotions the patient goes through. So that is the toughest part, like we empathize with them and we go through the same emotions. Yeah.
What is your favorite hobby?
Oh, my favorite hobby is I'm a social butterfly, so chatting with friends, spending time with friends, gardening, cycling, singing, and also walking, brisk walking. I do it almost every day for about 40 minutes.
As a woman in a senior position, how have you balanced your professional and personal life?
Okay, I don't know whether I balanced it well. I have ignored my personal life to an extent, but I think within limits.
If you could do it all over from beginning, which specialty would you pick?
Forensic medicine.
Who are you most thankful in your journey?
Okay, I'm thankful to Almighty God, because what I am today is because of God and His grace and mercy.
Could you share a defining moment in your career that shaped your approach to patient care?
Yes, actually way back in the early 90s, I attended a session with Dr. Arul Angratel, and he really opened my eyes when he shared how as doctors, sometimes we document things which we really have not seen. For example, we write S1, S2 heard. We wouldn't have even put the stethoscope there, but we write S1, S2 heard. So he taught me that how we should be truthful to ourselves and to God. So from that day onwards, I have not documented anything which I have not examined myself. So that has kept me out of trouble.
What is your favorite moment as a student?
Oh, my favorite moment as a student was my MD radiotherapy examination, Hodgkin's lymphoma case, and it went on very well to that extent that the external examiner had given me a very positive comment about my performance. I think that was the favorite moment in my life so far.
If you could pass on any wisdom to your students, what would you share?
Yes, I would say make hay while the sun shines. I think student period you have academics and you have recreational activities, and you should be knowing how to balance them. And I think the student period is a period where you learn a lot of life lessons, you go through a lot of emotions. But I would say that make it a habit to read something every day. It need not be a chapter, it could be just 5 lines, but you will gain a new knowledge every day. And also start the day with prayer, then you will see the difference how effectively you can accomplish whatever you needed to do on that day. Yeah.